what you said about length of time. Is a significant problem. Recognize that the proposal to have veterans schedule themselves seems like, to me, perhaps a common sense solution, although we've invested a lot of effort at the VA getting schedulers and policies in place. And I appreciate what Dr. LaPuz said about, he added the thing that I was going to add to what the chairman said, as my words, not his, but getting veterans to know they have the opportunity. In fact, they're entitled to have care in the community. And it seems to me there continues to be a unwillingness, lack of information, I don't know what it is, a failure, we could say it that way, for the VA to tell veterans, well, here's an option. I don't want to do anything that undercuts the importance of the VA healthcare delivery system in-house, and it's why, but we crafted the Mission Act in a way that was designed to make certain that the VA didn't have a restricted gatekeeping role in providing care to the community. And I have a mission myself of trying to make sure that that is still the opportunity for veterans who make the choice, if it's in their best interest, the criteria are met, that they have that access. So I would add to the chairman's comments about the length of time it takes to get an appointment, that also the confusion or lack of information that comes with both the person scheduling and the veteran, who often doesn't know what the rules are. And it is often the case in my experience that when I learned from you, Dr. Eleanor Hall, or anyone else in the VA leadership, this is our policy, it's not what the people in the VISN, in the local hospital, know to be the policy. And so you said this earlier, I'm just trying to confirm that what you said is still true. There is not a consistent application of the Mission Act across the country and even across the VISN that I live in. I'd be glad to have any response. Mostly I was just, that was my rant. That's the nature of, that's as bad as it gets.
No, Senator, I think you're correct in saying that we don't see at all times consistent application of these processes. And what is most important in all of this is affording veterans of all options that they're entitled to, including options under the Mission Act for community care. We articulate our priority on access by saying that veterans deserve the soonest and best care option available. Often that is a VA care option. Often it is a community care option, and veterans should be availed of that, as we've discussed before. I do want to give Dr. LaPuz a chance to talk about the oversight work that IVC is doing to make sure we get to a more consistent application of these standards over time. This is a very important effort that the Integrated Veteran Care Office is undertaking. Dr. LaPuz.
Thank you, sir. We are aware, we are cognizant of the OIG findings that there is inconsistent application of policies that are happening in the field, and that there's lack of awareness, like what you have said. And so what we're doing now is we are, first of all, re-educating and training all of the VISNs regarding our policies. So we are also reviewing our policies to ensure that the policies that we have are easily implementable. The second thing that we're doing is we're actually coming up with guidelines and checklists, so then we can share those, so then every policy will have a corresponding guidelines and checklist that we will share from to the facilities and to the VISNs, so then the VISNs can actually do their oversight over the facilities, and we can actually partner with the VISNs to ensure that those oversight visits are being done. So, and then we are monitoring all of the oversight activities that is happening to ensure that, again, there is a consistent application of the policies and guidance that we have put out, so then there is really a singular veteran experience.
I appreciate that answer. Let me tell you about a hearing we had last week in this committee. The topic was substance use disorder. Suicide and substance use are often linked. Overdose deaths have increased, and there's a nationwide fentanyl crisis. I'm not telling you anything you don't know, but I'm telling you about a hearing in which the testimony was the importance of timely connection in the circumstance of substance abuse and suicide prevention, that there can be no delay in the contact between a provider and the veteran. As I understand it, the VA does not hold inpatient or residential substance use services to the same access standards that the VA uses for other mental health and suicide prevention services. Those are minimum coverage insurance policies under the Affordable Care Act have basic access to, the policies have access to inpatient mental health and substance use treatment. Shouldn't that change and the criteria, the standards be the same?
I think it should change, Senator, and in fact, we've charged a group to look into exactly what the policy change should be for our timeliness standards for residential treatment for mental health issues, to include substance use disorder. And that group is going to be coming out with recommendations very soon that we will share when they are ready. But I will tell you that prioritizing access to this critical therapy in light of the epidemiologic trends you were just mentioning around substance use disorder and overdose deaths, we're seeing similar trends, unfortunately, in the veteran population. So timeliness of care for this service is extremely important. We'll be addressing not only our timeliness standards for internal care, but when and how we refer care to the community.
One of the reasons the choice ultimately that became mission was enacted by Congress, signed by presidents into law, was the lack of providers, adequate number of providers within the VA. And this clearly has to be an area in which that is the case, as there are not enough providers anyplace when we get to mental health and substance uses. And so it's, again, it seems to me that it's one of the areas in which the Mission Act has a significant role to play as we try to bring in all the available providers to meet this growing demand. Thank you, Dr. Adelon. You have offered to come to Kansas and spend time with me on numerous occasions, and I look forward to it's in my court, not yours, and I look forward to being able to tell you, yes, I'd love to do that.
Thanks, Senator. Appreciate that.